Yeah. So some of the key symptoms of a hormonal imbalance might be feeling fatigued, loss of motivation. So for women and men, obviously it's going to be different. Women could know based on what's going on with their cycles and how they feel during the cycle. Are they getting more irritability? Are they having heavier bleeding? Things like that might cue you into perimenopause or menopausal symptoms. Brain is just so big because your hormones actually contribute to your brain health. So as we age and the hormones decline, you'll see changes in brain health. So that could be, again, irritability, mood swings, memory losses, all of those types of brain functions. The other thing, your body physically, right? Things get harder to do. Physically, you might have more aches and pains. You could have hot flashes or night sweats. For women, men can get that too, but mostly you're going to see that in women. So there's a number of symptoms related to hormones. Your libidos could go down, obviously, that can change due to lowered hormones. Even digestive issues. So women oftentimes will feel bloated when their hormones are not balanced. And so it's very uncomfortable, and also headaches, migraines. So there's a number of symptoms, again, associated with imbalances in the hormones, whether that means I have too much hormones. So in women, sometimes there's too much estrogen, not enough progesterone. That can cause imbalances, or too much of a certain hormone.
What about on the male side?
Yeah, on the male side, you're looking at loss of muscle mass, or it's hard to work out like you used to, and you just don't feel as strong as you were. Loss of motivation, poor sleep, which you'll see with the females also is poor sleep, or restless sleep. You're going to see obviously lower sex drive. You can have loss of erections, and just like depression, anxiety, not feeling well, feeling irritable, general just like malaise, lethargic, fatigued. So when there's a hormonal imbalance, I think that the thing that I hear most often from the patient is something's just not right. I don't feel like myself. Like this is not how I normally feel. And it could have been creeping up over time, or it could have been something that just sort of came on what seemed kind of rapidly. Hormones levels and vitamin levels do definitely merge somewhere. They're important. You have to, again, as a holistic approach, you got to get all this right. Hormones have to be balanced, the vitamins have to be balanced. One reason why, for example, is when you make hormones, whether your body makes them or you're taking them in some kind of treatment, all of that is cleared through your liver. In order to process and clear those hormones, right, so you can make new ones and recycle the old ones, you need certain vitamins. So if you're low in those vitamins, you're not going to have a good job clearing those hormones, and you can build up an excess somewhere, right? So very important that you have the right levels of antioxidants, vitamins, and that your hormones are in balance. Usually you're going to see like vitamin D levels low, and you'll see B vitamin levels that are low. And it can be any of the B vitamins. There's a whole syndrome here where, again, these things aren't in isolation. You could have low vitamin D that is contributing to like a low testosterone. Same thing with some of the other female hormones. But usually, like I said, it's lifestyle. So my lifestyle contributes to what my vitamin levels are, what I eat, what I intake, how I digest, how I absorb. So all of that comes in together to create the picture of, what are your vitamin levels, what are your hormone levels. Any of those things being off, so your vitamin levels are off, it's going to impact your hormones, right? Your hormone levels are off, you're going to have probably a greater need for certain vitamins and minerals, right? So it's, if you went through each vitamin, you can come up with what that particular vitamin does in a very complicated cycle physiologically. But the bottom line is you need to have all these vitamins in place and minerals, and you need to have all the right hormones in place to really feel your best, to feel optimal. So for hormones, there's a lot of different treatments available for men and women. For women, a lot of times they just need a little bit of progesterone. You can take that in an oral preparation or rubbed onto the skin. Sometimes women also need testosterone. If they need testosterone, then you'd be looking at something like a cream for women. You can do pellets also, and there are injectables as well for men or women. So if I want to understand more about a woman or a man's hormonal level, first I'm going to do my consultation. I want to get all the signs and symptoms, make sure that makes sense. And then we're going to start to run blood work. And in the lab work that we look at, we're going to look at all the different hormones because, of course, you have the progesterone, the estrogen, the testosterone. Those are the sex hormones. But you also have hormones that are stress hormones like cortisol and food hormones like insulin. So I want to look at all those hormones and get an idea of what's going on metabolically for that person. Once we understand what that looks like, then we'll create a custom program. And for some people, that might just mean you have to change your diet, take some supplements, and all that kind of gets balanced, or you have to find what's causing this imbalance. For other people, it's you need replacement. So there's a conversation about replacement.